5 minutes, and so I see a couple cards turn up. I'll start with my colleague Alex and then turn to Evelyn.
Hi, thanks to all three presenters, but especially to the two who are still here. My question is to Rodrigo. Regulating access to firearms and alcohol clearly are ways you can get quick wins in reducing something like homicide, because we've seen it in your study, we've seen it in Diadema. It's been shown in several settings that these are quick wins. However, it seems that they presuppose a level of integrity and trust between the police and the population in order to regulate access to alcohol and guns, which may be not present in many situations where you need that level of trust and integrity on the part of the police. Because one of the critiques we get when we try and promote this in settings where there may not be such a level of governance that you enjoyed in Cali, even though you had corruption, is we're inviting corruption. We're giving corrupt police a check to write out to themselves by saying to this group or this gang, look, we'll turn a blind eye to your weapon carrying if you pay us in whatever, cocaine or money or so forth. Did you have issues like that? Were there perceptions that it might be inviting more problems than it might solve, and how did you deal with them?
Well, certainly it's a problem, and we had in Calif, the first time we did it was restrict alcohol sales and firearms on given days, and I think it worked better than in Bogota, and they had it permanently, because the restriction for alcohol sales, for example, was in public places, not private. So immediately all bars and alcohol selling places became private, and they will give a card and say, I am a member of that club, so I can drink that. In the case of Cali, since it was only on given weekends, they didn't have time to organize, but that's absolutely true. What Bogota did was to follow, say, you are a non-profit organization, okay, let me show me your income tax reduction, but it's very painful and it leads to corruption. So definitely it's a very, very important problem, difficulty. Finally, in Colombia, last year, the president ordered that no firearms should be carried. It was something we had been asking for 20 years. And finally, he said, it's forbidden. But of course, the army has some special, very special permits that they give. And this, again, leads to corruption and et cetera. But I think the prohibition of carrying firearms at the national level has been helpful, despite all those things.
Thank you, Rodrigo. Evelyn, please.
Thank you very much. Rodrigo, I don't have a question, but I just want to say that I really appreciate your theoretical model of risk factors and that approach. So I took many pictures, and I'd like to talk with you more about it after our panel, just because of time. But I thank you for your presentation about Sandy Hook, and you spoke about. I'm sorry, I'm Evelyn Tomaszewski with the National Association of Social Workers. You spoke about the research that you funded and identifying evidence-based policy and non-policy programs. Is the work of the Promise, Sandy Hook Promise, doing some of your own evaluation or assessing what, I mean, you mentioned that there were some interventions or opportunities to reduce risk. Could you talk more about that, or might that be something that you could do?
Yes, absolutely. I was not with Sandy Hook Promise during the time that they undertook a lot of that work and research. I think that it informed the programs that they chose around the precursors of gun violence, but I think there's a lot more work we can do to feed into that model of change that we've offered. There, particularly, in the legal and programmatic spaces, so that that continues to be, an effort of ours, and certainly one that we're trying to engage in across communities, trying to forge I guess working collaboratives with, the education policy community to do that, and as well as the public health community as well. But yes, I think, the biggest lessons that were learned from that work is really that most of our traditional gun violence prevention communities focus is quite late in the game, and there are very few of our organizations that have had the capacity and resources to walk a step back into primary and secondary interventions.
Thank you, Lauren. Meg?
Yeah, thank you very much. My question's for Lauren. My name's Meg Gardner with Child Fund Alliance, and I appreciated all the presentations very much this morning. And I, in particular, was struck by the work that you're doing on early detection, which I think is crucial. We don't hear about it enough, but it's really the nugget, I think, when we watch the incidents of gun violence in this country, and I think many other incidents of violence that we have documented globally. My question is what you've been learning to date about this approach, aware of the fact that some of what you're trying to do, which is so important, could be perceived as an invasion of privacy. How do you walk that delicate balance?
Well, especially because we're in schools and working with children, privacy is a huge issue. But I guess to the point of what we are learning, I think certainly as the policy person within our team who's observing and trying to scale the work that our program team is doing, it really comes down to the efficacy of implementation, because we have seen a lot of states react after Sandy Hook and after their own incidents of violence to implement the same programs and policies that we're talking about, including threat assessment and reporting, and looking at getting at these cases of violence before they occur. But we've since even seen shootings in those schools, like in Littleton, Colorado, where they had threat assessment implemented in their schools, and they had Safe to Tell, a reporting system, implemented in their schools. They weren't used or used effectively. So just because we are taking programs into our community organizations or into our schools, just because we're doing these trainings of our educators, doesn't mean it's really changing the culture or capturing these students in the ways that we need to. It's not just about layering on intervention after intervention. It's especially hard to make these cases for the new research and work that we're doing when we've already gone into a school and asked teachers to take 8 hours of their time to do an intervention that then we find examples of it failing. So, I think that is one of the things that we want to be very mindful of, especially on the policy side, is we want to scale this work, but that we just need to make sure that especially when we're identifying students early and talking about this idea of handoffs and interventions and connecting them to community resources, that's always kind of the afterthought in the conversation of these programs. It's identify, and then we don't always have the infrastructure in place afterwards to truly intervene in the ways that are necessary, not just to prevent violence, but also to get these students the education that they deserve as well.
Thank you, Lauren. We're going to take 3 more questions, and I would just ask, for the benefit of those that are watching us online, to please introduce yourself when you ask your question. So Judith, I'd like to turn to you, then to Thomas, and then to our final question over here. Thank you.
Thank you, team. Judith McFarland, Texas Women's University. Lauren, my question is for you. How have you penetrated your message in social media? one. Question two, please. How have you evaluated the outcome of your 100,000 students that you have given your message to?
Well, thank you. I wish I was a social media guru. We do have one, and she's doing tremendous work. We do try to elevate our messages on social media and engaging with, like I said, a very wide base. And I think that we do that through our careful language that's aimed at the center and giving. I think that there's always going to be just a lot of, email traffic and content that we're pushing out at people through any of our advocacy organizations. But what we're really trying to do in order to move our base up the ladder of engagement is to, break it down and make it simple. And so through social media and through our digital work, we're also offering opportunities for them to engage with us and each other in smaller conversations, which I think has been very effective in allowing our advocates to hear from each other in the smallest examples, even of what kind of living our mission looks like in their own communities, and that can be having small conversations online or in person, with other neighbors and family about gun violence prevention, or about these prevention programs that we work on. And I'm sorry, remind me of your second question.
Second question was outcome data on the 100,000 children you've worked with.
Yeah, so we've actually trained 1 million students and adults, and have just launched with the University of Michigan in a research project to really look at the outcomes of our programs as we go into these larger school districts in Miami-Dade and LAUSD in the years ahead. So the outcomes that we've been capturing from the schools who have implemented our 4 prevention programs are more just based on the survey data we're getting back from them and the anecdotal outcomes that I mentioned there. So we've got a lot more work to do to really prove out our model and to be able to show clearly what we're seeing in all of these schools.
Thank you, Lauren. Thomas?
Thomas App, Harvard Kennedy School. Mayor Guerrero, another excellent presentation. Every time I hear about the work that you did in Cali, it's more inspiring. I don't have a specific question. I just wanted to comment on that. I have a question for Lauren, also an excellent presentation. When you speak about gun violence, it seems clear that you're referring at least or emphasizing mass shootings, school shootings. As you know, that's less than 1% of all homicides. What is your organization's relationship or engagement to the sort of broader range of homicides, which are in some senses are far more frequent, but are more mundane and really struggle to get attention? Do you have any engagement with those issues? Do you view your work as separate? Just interested in your thoughts.
Yeah, we very much view our work as, as directly related to that. I think that when we're looking at any of these tragedies and sort of putting them into action, it's important to do it from the frame of your own narrative, and so I think our family members do that effectively. And of course, that narrative happens to be a mass shooting, but I think in our programmatic and our policy approaches, we're not just aiming at that 1%. Certainly we're working to do a lot around the intersection of mental health and gun violence and the issue of suicide, as well as, I think these prevention programs are aiming at, at preventing all violence, even violence that doesn't involve guns, and certainly not necessarily violence that ends up being mass violence. Now, it is starting early with children and in K through 12 settings, and so in that way, we also understand that we're talking about a different kind of violence, but I think we're all aware of the increasing evidence and the creep that is occurring around more suicide and gun-related violence in those age groups as well. So I think we talk about it through the frame that I think our family members come from, but with an eye to the policies that will help with the whole pie.
Thank you. And the final question for our forum.
So hi, my name is Elena Teacher-Rooney. I work at USAID. I'm the Deputy Coordinator for the Central American Regional Security Initiative. One of the things that struck me in the way that both of you have spoke about your interventions is the role of state or government actors in identifying potential risk factors or individuals at risk of perpetrating violence. When we talk about this, and I think that Alex got to this point to a certain degree, saying, well, how do you deal with corrupt police as the people who are identifying, who's committing the crimes, or as the enforcers of laws? Do you see for these very different types of homicide, on the one hand, we're talking about mass shootings, on the other hand, we're talking about sort of directed or organized crime shootings that are either for territorial, economic purposes, generally speaking, tend to be more related with that. Do you see different state actors as better agents as identifiers between those two, or do you think this really needs to be a whole of government approach? Because in Mayor Guerrero's discussions, it really was the judiciary looking at the police. In your discussion, it's really looking at the teachers and then also going back to Ms. Wen's presentation, talking about the role that the health system plays. So, is there a specific set of people that we should be focusing on as really training them up, or is this something that we should be thinking about? How do we mainstream knowledge of these indicators throughout all programming?
Well, I certainly believe that it is the latter. I think that we're engaging with, with the audiences that are sort of, are sort of closest to the issues that are, in our specific circumstance. But I think, as I mentioned to the last question as well, that brings up, the more and more incidences of breakdowns between systems and players and stakeholders in this work. So as we engage with educators, that is really the beginning. I think that that the more that we could, popularize the work that we're doing and the work of these indicators. Today we're actually, while we've been speaking, the Good Morning America was airing our a short video of ours that's launching our Know the Signs campaign, which is really trying to empower everyone to understand these indicators and precursors of gun violence, and to act. And so I'll hope